Welcome to Health Connect 24/7 live show, where we discuss about health, wellness, and how to stay healthy. My name is Sarah Shops, and thank you for joining us today. So today, we will be discussing about sex. Yes, the do's and don'ts of sex. Wow, I love the topic. So we'll be discussing about sex with Tomi Owolabi. He's a clinical psychologist, a psychotherapist, mental health professional, and a life coach. Thank you so much for joining us today.
Oh, thanks so much, Sarah, for the privilege to be here on the show today. Hope you're doing well.
Thank you for joining us. So, how are you doing? How are you enjoying this season of love?
Oh, it's a season of love, a time to show love to people, show love to your loved ones, to everybody around you. So it's been good so far. People are already painting the city of Lagos where we have, the red and white colors, going everywhere. The gift shops are busy.
Yes.
So it's a good one. It's a good one.
Yes, and I love that. So anyway, thank you for joining us. We are so grateful for having you on the show today. So let's just go straight into today's topic. Yes, so when we talk about sexual health and sexuality, what do we really mean about that?
Thank you very much for that. Most of the time, when you have someone, are you healthy? They tend to assess it from the point of, I don't have any disease, I don't have any infirmity. But the actual sense, for you to be healthy, one of the major components of your, physical health and mental health is your sexual health. Those are one of the key contents of, your physical and mental health. So for you to say you're physically healthy and mentally, healthy, that your sexual health also have to be intact. So the WHO, defines sexual health as a complete state of physical, mental, emotional, and social well-being in relation to your sexuality. It's not just the absence of disease or dysfunction or infirmity.
Yeah.
So your sexual health entails your ability to be able to, communicate and express your sexual orientation, your sexual pleasure, your sexual desire. Your sexual health entails your ability to look at yourself and have that self-acceptance. You look at your body, you're okay with it. You look at your shape, you're okay with it. You look at for females, you look at your breasts, you look at your buttocks, you're comfortable with it.
Yes.
For guys, you look at the penis, you're satisfied with it. So your sexual health entails a whole lot of things. It's not just your ability to perform on the bed. So this goes to the knowledge you have. Do you have adequate knowledge about what sexual entails? Or do you know what to do when you have difficulty? When you're not able to, feel that emotion, or if your body is not able to physically respond to sexual stimulation, do you know what to do? So your sexual health also entails that, and your sexuality also entails your ability to express your sexual orientation, express it emotionally or behaviorally in a way that is generally acceptable and appropriate.
Well, thank you so much for that. One of the key things I just picked from what you just said now is that sexual health has a role to play in our general health. And it's so important for us to learn about our sexual health, to be knowledgeable about it. Thank you so much for that. So, is it actually essential to be educated about sex? Or is it essential to be educated about sex as an adult? So what I mean by this question is that at what age, I'm going to share it into both adults and for children.
Okay.
So at what age do you think we need to start educating people from the young age to adults about sex?
Okay, thank you very much for that. There are two aspects to it. Who are the people to be educated,
Okay.
and the people doing the education? One, most of the time, you say, it's the role of the parents. Some people say it's the role of the school where there is attending. Some people say it's the role of probably the society to educate children about sexual education. But one thing that is key is that when children are growing up,
Yeah.
the information you pass across at every age group is very important. For example, children between the age of 2 or 6 find so much pleasure in playing with their genitals. Most of the time you see parents, yelling at the child, "Will you stop that? Will you stop doing that?" So children at that age group, they've associated, playing with their genitals to something that is bad. Whereas that act of playing with genitals at that age is not either bad or wrong. But what the parent could have done at that point is, trying to caution the child in a way that the child will be comfortable with. That, this is something you don't do this in public. You do this when you are when you're in a cold place or you are alone. Because at that age, they find pleasure. The point of gratification is the genitals. So it's essential that, let's say from 2 years to 6 years, there is a particular set of information that comes across.
Okay.
The children should be able to know the different parts of their body.
Yeah.
At that age, you are not talking about, don't have sex, don't do this. No. You are talking about, this part of your body is called this. This is your penis. This is called your vagina. This is called your vulva. This is called the chest. This is called the breast.
Yeah.
At that point, they should know the different parts of the body. Then when they get into the puberty stage, for example, you can ask, probably you are watching the film with your child, you can ask the child, how do you think babies are made? Probably at that puberty age, maybe 12, 13, and 14.
Okay.
And most of the time, parents are not comfortable discussing about these things.
Yeah,
So if you know that you're a type of parent that is not comfortable about it, you can start off probably from that watching the movie. How do you think parents are made? Just to have an understanding of, before you start educating them, try to know what they already know, the knowledge they already have in the first place. And most of the time, your child or you yourself will not be comfortable. So the parents can try to avoid that eye contact initially at that place, so that in order not to make that child uncomfortable. So by the time you hear the feedback, this also, the child is telling you the child grows in the tummy, then you are able to educate the child that, no, baby don't grow in the tummy, the uterus, you explain everything, the process of sexual intimacy. So for every group, at every age group,
Yes.
there is a particular information that is communicated to. It's essential that parents also acquire the information, because it doesn't, parenting and sexual education doesn't come automatically. The fact that you're giving back to children, or the fact that they're adults, it doesn't mean you know a whole lot about sexual education. So you have to acquire that, and that's why we have a platform like this, where you can probably put a call across, speak to a professional on how to go about communicating sexual education to your children. Now let's come to the adults.
Yes.
Especially when it comes to sex and everything. Some adults doesn't. For example, I was going through a study, and they related that for females that are above 30,
Yes.
that about 75% complain of not achieving orgasm,
Okay.
even as at the age of 30, without knowing that for female to achieve orgasm, for some it goes beyond just the thrusting, just the penis penetration.
Yeah.
If the clitoris is not properly stimulated, they might not be able to. Something as basic as that can be so important. You'll be surprised that as an adult, some people are not even aware of those basic information. So it's all about getting the information from the right source.
So how can people get information from the right source? So before you answer that, I want to talk about the educating children or educating people about sex at different age groups. Yeah. So I think for children, I think it's better infants.
Okay.
And what category will I put them? It's better parents actually tell them. Sometimes parents, instead of them telling them that this is your breast,
Okay.
this is your penis, giving them the right name is kind of difficult for some parents. But thank God for the civilization now. Parents now name the body parts
parts
according
yeah.
to the name. I'm not saying, oh, this is your Tori, this is your this. But anyway, thank you for that. So, how can people actually get information from the right source about
So
this?
I think for now, getting the information is not the major problem. Getting the right information
Yes.
is the key thing. That's why we have a platform like this where you can subscribe to any of our plans and speak with therapists or people that are well educated, healthcare professionals, mental health professionals,
Yeah.
that can actually tell you the right things to do. Majority of, if you go to Google now, you press
Different bloggers.
different things will come, and to your surprise, you'll be shocked that some of these things that popped up, they are sponsored, ads.
Yeah.
They are sponsored ads. Even the ones that don't indicate the ad, they are articles sponsored by different people just to propagate their
Yes.
own, morals and agenda. So the best thing is to reach out to a professional. You can get books, buy books on how to go about it, on parenting, and how to conduct sexual education. And if you know people around you, professionals, can also reach out to them. Parents can come together, share thoughts, share experiences, and they're able to get good and necessary information about how to go about it.
Yeah, that's great. So, how to get the right information is that all you need to do is to read books. Also, you have to seek medical advice, like seek professional advice. Don't just read whatever you see online, and you think that sometimes it might not be the right information that you need. So you have to seek professional advice, and also to speak with someone that you trust, that you think that the person is good at that particular topic. And we are talking about sexual health. So if you are just joining us, thank you so much for joining us. We are talking about sexual health, sex in quotes, and the unspoken fact about sexual health. That's what we're discussing. So thank you so much for joining us. And please, if you are just clicking on this link, please follow us on our page. Anyway, thank you for joining. So, Toby, how can we engage in pleasurable sexual intimacy?
Now that's a very, very good question, and this is the point I want all our viewers to pay attention.
So, guys,
Husband, a wife, a guy, the lady, and you're already sexually active.
Okay.
One of the things to do is you have to be prepared both physically and mentally. It's essential that you're prepared, physically and mentally. At times people have this intention.
Okay.
I'm visiting, my wife is coming around, or my boyfriend is coming around, my girlfriend is coming around, or my wife will be at home, my husband is returning back.
Yeah.
They have the plan, they're going to have, or they just feel
We're gonna enjoy ourselves.
they're going to enjoy ourselves, or they
Yes.
just feel to prepare. And there's a general saying that he will fails to prepare is preparing to fail. So physically, you have to prepare. Mentally, in terms of what you do, preparing the mind of your partner ahead before the time. For example, a man can send lovely text messages to the wife, to the girlfriend, just to prepare, just to keep the partner in the mood to do that. And another thing to do is most of the time partners don't engage in foreplay enough. It just, especially for the guys, for the men, it just the men are more of the impulsive type. It's all about what they see.
No waste of
What
time.
they see, they just want to rush. But for women, it's not always like that. For women, it's more of a responsive thing.
Yeah.
Also, it's good when you engage in foreplay long enough. And when you're engaging in foreplay, don't be too in a haste to go to rub to touch the breast, to go to the vagina, the vulva. Just as guys, just calm down first.
So I need you to explain how to do that.
Calm down.
Okay.
Just try to explore. When you are able to explore something, you are able to get the best out of it. So you explore, you look at, okay, which part of my wife's body, apart from the main genitals, can I touch that will, make her desire more and make her arouse? Are you talking about the hairs, the back of the hairs, the neck, rubbing the legs, rubbing the thigh, and guys, don't be too much in the haste to remove the clothes and, maybe one step at a time. You can start from probably removing the wig, from the wig,
don't even go there.
from the wig, you start from removing the, gradually, and you just, prep yourself and your partner. It's not just something you just rub. Before you know it, you fling the shirt, fling the bra, fling the panties, and fling the whole thing, and just you also need to put your partner into consideration because for females, it takes that process. Another thing to do is also to ensure that the environment is right.
Alright, so before you go to the environment, you made mention of preparing yourself physically. So how can we prepare ourselves physically?
Okay, preparing physically has to do with, I know I'm going to have sexual intimacy, sexual intercourse with my wife this evening.
Okay.
So try as much as possible not to engage in things that will make you so exhausted. Because without stamina, you may not be able to perform optimally. And when you don't perform optimally, you don't get that sexual satisfaction that everybody wants to get after maybe your partner has been looking forward to that experience. You now come home, before you know it, you just don't have, the guy doesn't have the strength to carry, the whole stuff, to carry out the whole task as he ought to. So, because the person has been physically exhausted. So, what I'm going to come, physical aspect. The exercise thing and everything, all those things are very, very important in order to be able to, get that sexual satisfaction and fulfillment after the whole thing.
All right, thank you so much for that. So let's now talk about the foreplay. You made mention of the foreplay. I need to mention the types, if there is types of foreplay, because you just talked about you don't go straight to fondling the breast or something like that. So what are the types of foreplay and how can people go about that? Since a lot of people don't really go the route of foreplay, like having foreplay, doing the right thing. So
what are the types? Part of the things you can do during foreplay is for example, kissing.
Okay.
Having that, deep tongue, you can start by kissing. You may not have to start with kissing from the lips, from the tongue, kissing the forehead, kissing the cheek, and all those things. So those are some of the things you can do during foreplay. Then hugging, that's huge, that intimate hug, in-depth hug, which is felt by both parties. Those are part of it. Then rubbing of the lap, of the thigh, just not try to rush into getting to where the where the real thing is. You rub, you explore, and you also, and one thing that's essential in order to get the best communication.
That's key.
It's very key that you communicate. As a lady, let your partner know the area that makes you more aroused, so that you can, get that optimal satisfaction. Tell your husband, no, don't touch this place. I want you to just rub this place for now. Okay, rub this side, rub my thigh, rub my breast, rub my nipple, and all those things. So communication is also very essential in all those things.
Okay. So I think we stopped at we're still talking about the ways to engage in pleasurable sex.
Yeah. So another way is this one is more peculiar to the lady. Okay. You need to be attractive. You need to be attractive.
That is very.
When we say attractive, it's not only about the face attraction.
Okay.
The facial attraction.
Okay.
What about the underwear you're putting on? Is very important. Men, guys are not moved by what they see.
That's true.
So you can imagine the guy coming, you're looking forward to having sexual intimacy with the wife and looking at the partner with torn panties or dirty undies and those things are not for it puts some guys off merely seeing those things. But when you put on the sexy panties, the sexy night wear, and you ensure that you hold and the way you roll your body when you carry yourself, your partner is already in the mood.
His head is already
turning,
Oh my
that,
God.
in fact, your partner just can't wait to get to the real thing. So it's very important that you are attractive. You look attractive down from outside to what you have, underneath. So everything has to be in place.
You are being partial now because we actually focus on the women alone.
No,
We need to talk about the guys too, because how will a lady be attractive to the man and then the man is not actually attractive? Because it has to be a two-way thing.
Yeah, it's a two-way thing, especially when it comes to the place of hygiene.
Okay.
Both parties have to take responsibility
It's not the
for
guy
that.
that wear boxers for like 3 days.
Exactly, that's what we're talking about. That is not appropriate, and that is not the right thing to do in order to get the best. So the other time I was talking about the environment.
Okay, yes.
The environment is very important. You can't imagine somebody trying to engage in sexual activity and you are not sure, you are scared of, will anybody just enter the room at any point in time? Those things has the ability of, affecting or making either of the partner not to be fully committed towards the sexual act. Because at the back of the mind, we are bothered about, will somebody come in or will somebody shout my name with a phone ring? So when it comes to environment, ensure if you need to pull the phone off, you need to put it on vibration, you need to lock you, if you need to go somewhere else, probably outside of your house, probably lodge in a hotel with your partner to do in order to avoid and ensure that you have a good environment, then that will be good.
Oh, okay. Thank you so much for that. So, when the season of expressing our love, expression of love, how do you think people can engage in safe sexual practice?
That's very good. Safe sexual practice is very important, but most of the time to engage in sexual practice is almost impossible. So that's why we try as much as possible to use safer, sexual practice, because the only way to achieve safe sexual practice is pure abstinence. Whether as married or as unmarried. So even if you are using contraception like condom, you can still have 100% guarantee. Even 99.9% is not 100% guarantee. So, safer sexual practice involves the ability to have the right information. Proper hygiene is very important when it comes to safe sexual practice. For people engage in express their sexuality in different ways and different forms. You can't imagine somebody going to the market, you've held a whole lot of things, you go out, and by the time you come in, you are using the same hand to stimulate your partner in the vagina, in the exposed area and exposed region. That can cause a whole lot. So that's not an healthy practice. And one of the things you can also do to enhance safe sexual practice is to be able to using of contraceptions like condoms in order to avoid transmission of STIs and unwanted pregnancies.
Okay.
So all those things are very important. Another thing to ensure that you can do to guarantee safe sexual practice is not to engage in sexual activities when you are under the influence of alcohol or substance use. Because
that's very key.
They have the capacity of altering the activities of your central nervous system, your consciousness, what you do has been significantly altered. So you are likely going to, for someone that doesn't want to engage in unprotected sex, or because they're under the influence of alcohol or any substance use, your thinking, your decision has been altered. So by the time you engage, by the time your face is down, the effect of the drug or the substance now winds off, you're already blaming yourself and regretting your action. So it's essential and very important that we don't try as much as possible not to engage in sexual when you're under the influence of alcohol or substance use.
Okay, thank you so much for that. So now I want to ask, when we talked about the foreplay, the kissing and all sorts, And you know, sometimes let's not even go into for those that are married.
Okay.
People have sex even without
Yeah,
them
sure.
being married. You know, a lot of things can actually go wrong at that point. If you are not sure of your partner and then you are engaging in having sex frequently, we might have incidents or cases of maybe sexually transmitted infection. And you know, that's why we need to be very sure of our partner's status before engaging in any sexual practice with the
Sure,
person.
sure.
So now I want you to tell us what sexually transmitted infection actually means and the causes or the common causes of sexually transmitted.
Okay, so in a simple definition, the STI, sexually transmitted infections, or sexually transmitted diseases are diseases that can be contracted while engaging in sexual practice. So, if you want to stay off STI, STDs, you want to stay off it and abstain. But if you can't abstain, ensure you use the basic contraceptive like condoms. So and STI, there are various forms of STI studies. The CDC brought out a study saying they record about 20 million new STIs every single year, and all these infections have the ability to affect or cause other diseases or other ailments in a person's health, because it will shock you that most of the STIs and STDs don't present, or probably 50% of them don't present with symptoms that can be easily seen. It can be infected with sexual transmitted infections or diseases, and you may not know on time. So that's why it's very essential and key and important that we have a regular checkups.
Okay.
Do a regular checkup, and one of the things that increases the chances of one contracting STIs, the people that stand the high risk of contracting STIs are people that have more than one sexual partners. So for the guys and ladies there, you gotta be careful. Okay? You gotta be careful, play safe, do it safe and healthy. Because having multiple sexual partners increases your chance of getting sexually transmitted infection. And I don't think you want that for yourself or for any of your partners.
So what are the common STIs?
Now for the common STIs, we all know about HIV.
We let's just assume we don't know.
Okay.
Okay.
So we all know the HIV is a key thing that's one of the diseases that can be transferred as a result of sexual infections. Although we know that it's not curable now as of now, but it can be managed.
Yes.
People with HIV, but they're still living their life very well. So in order to avoid that, so contraception
I just needed to
is
mention.
very important. We have gonorrhea,
Okay.
we have hepatitis,
Okay.
we have the UTI, we have the bacterial vaginosis, which is caused by the growth of unhealthy bacteria in the ladies' genitals. We have the genital herpes,
Okay.
which is caused by the herpes simplex virus.
Okay.
So there are so many of them that we can't even the syphilis is there and all those forms of to see.
All right, thank you. So how often should we get checked for STI?
Okay, how often should we get tested?
Yes, it's very important.
It's essential. When you have to change your partner, it's very
Okay.
essential you get tested for STI so that the parties can know that you are on a clean note at any period in time that either coincidentally or incidentally you engage in unprotected sex.
Okay.
It's very important that you do that. But anytime you share sharp object with other people,
Okay.
try as much as possible to do that. But even if you don't follow this category, it's something that we should do regularly, probably every 3 months, every 4 months, and even if you are faithful to your partner, because all those things, there are still other ways that people can contract some of the disease and infection listed, but the use of public toilets, public spaces, and all those things. So even if you are not probably cheating on your partner, you can still get infected with all those things. So it's essential that
Okay, so let's just say that every 3 months or every 6 months, right?
3 months.
If you don't fall under the category
Those,
of what you just mentioned. Anyway, so do you like what you've heard so far? So I want you to click on the notification bell, and if you haven't followed us, please just follow us right now as you're listening to us. Follow us on our Facebook or Instagram page so you won't miss any update from us. And also, if you have any question that you have, yes, if you have any question, just drop in the comments. Yes. So because we are going to answer some of the questions, and if we can't answer some of the questions, I'm sure we are going to answer that. Yes. Thank you so much for staying tuned. So let's get back into the show.
Right.
So what are the sexual dysfunction that we have, and the possible causes, including the types of the sexual dysfunction that we have?
Okay. Sexual dysfunctions are consistent and persistent inability to respond both emotionally and physically to sexual stimulations. You know, when you are sexually stimulated, you find it difficult to respond emotionally. You find it difficult to respond physically. Because there are two different things. You may be able to respond emotionally, but you're not able to respond physically, and vice versa. It was essential that we understand this fact. There's consistency in it. Consistency in your inability to respond both emotionally and physically. So for guys, we have common types of sexual dysfunction in guys. We have the male hypoactive sexual disorder. That's the inability to have desire for sex. The shock that we have with marriage cases where people will say, oh, I don't like sex. I don't have that urge. I can have 3 ladies undressed, different ladies of different shapes and sizes undressed in front of me, and I won't just have that desire to probably engage them, sexually. So that's a form of sexual desire dysfunction. Sorry. Then delayed ejaculation. In this case, this person is able to have that desire to engage in sexual activity, but the person is not able to sustain that erection. You can imagine how distressing it would be, and you'll be shocked that studies have revealed that 40% of men above the age of 40 do have, have chance or do have sexual dysfunction. But it's unfortunate that about 75% of the people that fall in this category don't seek for professional help, because we've termed it as something that is that brings about that stigma. So people just keep quiet about it, and they try to deal with the situation by themselves. So for our viewers, if anybody or you in particular, you have any form of sexual dysfunction or difficulty as regarding your expressing yourself sexually, reach out to us and subscribe to any of our plans. We will speak with
I'm sure we're going to talk about that later.
Definitely. Yes. So male hypoactive sexual disorder is one of the major sexual dysfunction in male, and delayed ejaculation too. And we have what we call the premature ejaculation too. So that happens, before you reach that fulfillment level, that satisfaction state, the man has already ejaculated, has already gotten to orgasm. And we have what we call the erectile disorder. That is the inability to have that, to physically respond to that stimulation. The person doesn't find it very difficult. Most of the time, he or she wants to engage in sexual activity, find it very difficult to have erection. So these are key things, and studies have shown that one of the 2 things that cause distress in relationship is 1, sex, money. So
Sex, money.
those two key things are one of the factors that bring about, difficulty in relationship among people. So it's very essential to pay attention to this thing. So for female, you also have what we call the penetration disorder. The penetration disorder is people that experience difficulty, in having when their partner, especially in heterosexual relationship, when their partner is trying to trust them, they have that severe pain. So that as a result of that pain, they try as much as possible to stay off anything that has to do with sex. But this is usually majorly psychological. I want us to know that for us to be able to establish sexual dysfunction, there are things we have that the medical professionals have to rule out what we can say, so that we can know, we can fully ascertain that this thing is not as a result of a particular medical condition. And we also have the hypoactive, the female hypoactive sexual desire.
Okay.
Among the desire for sex is not just there. They don't even fantasize about engaging in sexual activity. These are key things. You see people having serious issues in their relationship. You hardly know what the problem is, and especially when they even have a partner that doesn't have a good understanding, that is not supportive, makes the situation more complex for the lady or the woman. So all those things are key. So if you have any form of difficulty in having sexual arousal, in enjoying your sexual activity, in finding fulfillment after the end of it, please try and ensure you reach out to a professional.
That's it. That's
Sure.
true.
It's very important. Yes, you say you want to get information online, but it's very important to get exactly.
You have to get to the root of the problem.
Exactly.
And one thing about sex is that one of the key things in sex is that it has to be enjoyable. If you are not enjoying it, that's definitely there is a problem in it.
True.
So,
sorry, can I just chip in?
Yes,
what
go
you just
ahead.
mentioned now.
Okay.
I can't remember reading that there was a study that I read about the fact that reasonable number of females do fake orgasm.
That's true. I don't even let me say that's true. I think, okay, just go ahead.
Okay. They fake orgasm because they don't, in the real sense of it, they don't achieve orgasm. But they feel that something is wrong with them. So in order to probably conceal that and cover that, just try to, fake it so that the partner also can know that, this
we are all
person,
good
we are all
together.
good to, whereas the person is dying in silence.
Oh, God.
Whereas, as simple as the information of clitoral stimulation is, that can help solve the problem. As simple as psychoeducation, sex education can help the individual to solve the problem. So it's only about the lady now, or the woman. It's about the man needing enough knowledge to be able to know how to help the partner to achieve that sexual pleasure and sexual fulfillment.
Yeah, that's true. And that's why communication is very important.
Communication
After sex, I feel like people should actually have communication, not just people, the partners. They should have communication about the sexual activity they just had. Oh, did you enjoy it? What do you think we need to adjust? What do you think we need to improve? And with that, I'm sure that over time, things will improve. You want to say something?
Yeah, exactly. When it comes to communication, it has to be before, during, and after. Before, during, and after. Oh, you can tell a partner, how do you want us to go about it? You can have a conversation about it. During the sexual act, if you're enjoying it, let your partner know that you're enjoying it. Don't just lie like a log of wood or just stay.
I don't think people still lie.
During that process, let the man know you're enjoying it. Let the woman know you're also enjoying it. Communicate it during. It has a way of motivating both parties to feel that, pleasure and satisfaction. And
Yeah.
even after the act, this is particular about guys. Once the deed is done, they just want to move on, either sleep or go to the restroom, blah blah blah. But at that point in time, after the whole thing, both partners have achieved orgasm, the female will still, want to, be cuddled and all those things. So those are key things that we should, start practicing. We should have understanding of in order to be able to, get the best out of our, sexual life and also enhance our sexual health.
Yeah, that's true. I think there is a saying that says that sex is responsive and not what.
Okay. Being responsive, and for men it's more of a spontaneous thing.
Okay, that's true.
Yeah. And for ladies it's more of a responsive
thing.
Responsive
Communication is very important.
Exactly.
Don't just do, okay, let's do the do, and when you're done, you just stand up. No, it shouldn't be like that. So, thank you so much for still staying tuned with us. I hope you're enjoying this session with us. And please, you can share this link with your friends. Let them join. Yes, share, post it on your page. Would appreciate that. So, Tommy, we just finished talking about sexual dysfunction. How do you think sexual dysfunction can be treated?
Well, sexual dysfunctions are treatable.
Okay.
To a large extent. So I want our viewers, to know that they have treatable sexual dysfunction. So one of the things that can be done is have medication.
Okay.
And most of the time, people that have sexual dysfunction tend to probably self-medicate, just read something online, okay, get the pills, get the drugs, but that is dangerous for health. So one of the things to do when you find out, just reach out to a professional. And some of the treatments that have been found to be to get results on medication. Speak to your doctor, speak to your urologist, speak to your sexologist. Be able to come up with something. And we also have the psychotherapy.
Okay.
So
that's where you come in.
Exactly. We're able to. So we've been able to manage a whole lot of cases. Even in couple therapy, even as individuals, various forms, neolipo, active sexual, desire disorder, and different types of premature ejaculation.
Yes.
A whole lot of people are battling with it. We'll be able to help them, provide psychotherapy treatment for it. Then hormonal therapy too. It's still something that is quite applicable in the management of sexual dysfunctions.
Okay, thank you so much for that. One thing I want to say is that for this platform, this is Health Connect 24/7, where you can have access to speak with professional and licensed doctor. We also have clinical psychologists and a psychotherapist. So that means that when you have issue with your health, or you think you need to speak with an health professional, I think this is the best platform for you to do that. So it's a toll-free line, and the subscription plan is very cheap. Yes. So I would want you to visit our website. That's www.healthconnect247.com. Yes, I repeat, www.healthconnect247.com. On the website, you would have all information about this organization, including our toll-free line is also there, and also for you to be able to access quality health care. So thank you so much for still staying tuned. Yeah, so tell me, we've just finished talking about sexual dysfunction now, and you made mention of some people not seeking professional help. They just go ahead by just making research online, and then, I feel this will work, and then they go and get the drug. So do you think using sex enhancing pills is an healthy thing to do?
sex enhancing pills.
Yeah.
So one of the things we need to look at is, okay, why is this person using sex enhancing pill? Any pill you're going to use in order to manage your any sexual difficulty you're having should be prescribed by the medical professionals.
Okay.
So it's very important that you don't do all these over-the-counter medication. Ensure that you speak with your doctor first before you go ahead to use the pill, because most of these pills that we just see flying around, they're not too healthy. We don't have enough research to back them up, to establish their efficacy, and some of them contain some unhealthy, ingredients.
Are you sure?
So it's not healthy to use pills. You're going to use any pill, ensure that it's a pill that is prescribed by your doctor.
That's true. So what would you say about the pills or the drug that they sell online? You've heard of Kayamata or what's it called, and different things. And all those things, I think, actually help, because the rate at which people buy it, man, it shows that it's really, really helping.
Yeah.
And I feel that maybe because of the natural things that we mix together, I'm not sure, but it helps, because some people still come back and give testimony online.
All right. It will be helpful.
Okay.
You may see short-term results, but what about the long-term consequences?
At least it's the short term that's
it's very. You want to use your old age, not being able to perform effectively when you ought to. So there's nothing stopping you that as a man at the 60, at the 70,
you're still enjoying.
You're still agile. You're still firing.
It's very important.
You're still firing on all cylinders.
Oh my God.
There's a prominent traditional ruler in the southwest of this country. As old as he is, he's still marrying a new wife. So tell me, if he's not active, or if he's not firing on all cylinders, do you think he will still be? So you have to look at the long term.
You cannot be sure if he's still firing on all cylinders.
All right.
All right. Thank you so much for that. So, what's your take on oral and anal sex?
Well, according to looking at it from the health science perspective, oral and anal health is a form of expressing your sexuality.
Okay.
So it's totally seen as something that is normal, as long as it is done appropriately. The hygiene is put into consideration. But one of the consequences is that it increases the chances of contracting sexually transmitted infections and diseases. So as much as in terms of scientific health science perspective, it's okay, all right, it's a part of expressing your sexuality, but there are also consequences, there are also danger. So, and from the cultural and spiritual or religious perspective, that is, termed as not appropriate. So it all depends on the value that each person holds or work with, their philosophy about life, their values in life. They may see that as not proper, not appropriate, and not moral. If you're looking at it from a angle of the cultural perspective and the spiritual perspective. But from the health science perspective, I think it's appropriate as long as the major precautions are taken, hygiene are taken into place, but it increases your chances of getting STIs.
Okay, so people engage in self-sexual stimulation and such as masturbation. Do you think is actually harmful, or is the right thing to do?
Okay, I'll also answer that question from the two or three different perspectives.
Okay.
From the health science perspective and also from the cultural and religious perspective. From the health science perspective, for females and for males, masturbation has been seen as a form of one of the ways to express your sexuality, one of the ways that can help you to achieve sexual satisfaction.
Yeah.
For females, sex researchers have proven that it helps, the individual to probably, achieve more sexual pleasure when engaging in a heterosexual relationship or engaging in physical sexual activity with their partner. So for females, research has proven that it is okay, even for male secretary at home, like it is okay. But too much, even science proven that too much of everything is not good.
Yeah.
So if it has come to the point of you engaging in masturbation is hindering, is affecting your desire to engage in sexual intimacy with your partner, then there is a problem with that. So for males, it has been found that people that practice masturbation consistently usually result to healthy ejaculation when they decide to engage in heterosexual relationship.
Yeah.
So it's all about drawing the line. Too much of it, doing it regular, has its own consequences. From a health science perspective, masturbation is appropriate. But when it comes to the cultural perspective, the religious and the spiritual perspective, they see it as something that is not morally right. They see it as something that is against their values, the tradition, the cultures that have been held on over the years. For example, the Christians will tell you that it is not appropriate to engage in what the Bible says or talked about is for you to engage in sexual partner with your wife and not all those things. So depending on the perspective you're looking at, from the health science perspective, they're actually okay and good. It's a form of expressing yourself sexually, but it has its own consequences, especially for males.
Okay. Alright, thank you so much for that. So my last question to you, because we are going to be wrapping up soon. How can we care for our sexual health?
Well, sexuality is something that we have to be intentional about. I was watching a documentary on ABC now. It's ABC or CNN, interviewing and engaging a man that's close to about 80 and is still really agile, functioning sexually and all those stuff. During the course of the interview, some of the things he has planned for it right from his early age, from his early years. He was intentional about it, the lifestyle modification, cutting down on alcohol use, cutting down on smoking. Those are key things that usually cause sexual dysfunction, and your ability to be able to do regular exercise, paying attention to your diet, eating right, all those things play a key role, and ensuring that your relationship is not toxic, being faithful to your sexual partner. So all those things are very important.
Wow. Thank you so much, Dr. Tokyo Wolabi. Thank you for joining us on the show today. Have you learned anything so far? If you've learned, if you are really enjoying this section and you want us to have another live show, just put in the comments I want to be seeing your comment right now. Yes. So thank you so much for joining us. That will be all for this session of Health Connect 247 live show. Be sure to follow us on our social media handle. That's on Facebook, Instagram, Health Connect 247. No other Health Connect 247. Yes. So what do we do in our organization? Health Connect is a leading telemedicine provider that combines next generation telemedicine, telemonitoring, and home health technologies to provide patients with 24/7 access to highly trained and experienced doctors, clinical psychologists, wellness experts, and care coordinator. So, what are you going to benefit if you sign up on our platform? You have access to 24/7 virtual access to doctors, and then you don't need doctor's appointment before you can speak with the doctor. I think that's great. Also, you have unlimited toll-free calls. That means that you won't be charged for the calls you make. I think that's very interesting because you don't have to use your airtime just to access healthcare. Yes, that's why this platform is there. Another thing is that you have multiple consultation language options. So if you choose to speak in English, Igbo, Hausa, or Pidgin, we have doctors that can speak those languages. So it depends on what you want. So our toll-free line, I'm sure you probably want to sign up. You can call us on 08000 432584. 08000 432584. My name is Sarah Shobola, and thank you for joining us today. Bye.
Bye-bye.